Okay, good morning, everyone. We're going to go ahead and get started. As I mentioned earlier, we do usually wait until 8:32 to start this meeting, but we have a bit of recap sort of in the first couple of minutes. So we're going to go ahead and get started to make sure we utilize the time well. So this is the August meeting for the Garrett County Child and Adolescent Wellness Workgroup. It is a sort of packed agenda this morning. We're going to try to move pretty quickly. I'm going to go ahead and pull up the agenda here real quick. And then just as a note, we do have the fabulous Beth Brenneman with us, taking minutes, making sure all of this gets coordinated. So I always like to make sure we appreciate her at the start of this meeting for helping keep all of this together. If somebody could just let me know, can you see my screen? Okay, awesome. I'm gonna go ahead and turn my camera off too, just to make sure I'm not using any extra bandwidth that we might need. So to get started, the first thing that we always do with this meeting is just an open call for presentation series. We've been doing that for a while now, and I think that's been a pretty effective way to disseminate a lot of information. So this is open to anyone who wants to present on a health-related topic to improve public or population health. Just email myself or Beth Brenneman. I will put my email in the chat here in a little bit. And we do typically keep that open. We've had presentations from WIC, we've had presentations from cancer control programs, Adolescent PRP, a lot of different things, our local management board and behavioral health authority. So I just want to keep that open for anyone who is interested in coming to present to this group. It's a really great opportunity. We have several providers, support staff from different agencies that come, and it's just a good opportunity to sort of disseminate a lot of information, and then also have that recording that is posted on the health department website. So that is available. You can email myself or Beth Brenneman if you're interested in participating in that. And I just want to remind everyone as well that when you go to the Garrett County Health Department website, all of the resources for this meeting are under news. So it's right down here under news, it's Garrett County Child and Adolescent Wellness Workgroup. There's also the Health Planning Council and a couple other things that we're working on adding to the Health Department website for some of these public meetings. But at the moment, this is the tab that you would probably be interested in. And if you scroll down here, it has all of the recordings from previous meetings. It does take a minute to load from YouTube, but the YouTube videos will load here in a second. And you'll be able to click on those. You can watch them. There they are. And you can see some of the previous meetings that we've had. So there was Shelley from 360 Access Hub talking about the Garrett County Food Bank project last month. We had cancer control. And then if there are presentation slides or any other documents, PDFs, anything like that, we do upload them here so that folks can access them, download them, and have that historical knowledge. So, and as I mentioned, this is mostly recap so far this morning. But the other thing that I do want to mention, the first thing on our agenda this morning for the presentation is going to be a data packet update specifically for behavioral health with a focus on child and adolescent behavioral health. And this is kind of a continuation or sort of an expansion based on what was presented in the April 2025 meeting. So that's this recording here. The slides are also already available for that. And this was a really good overview of all of the data sources that are typically utilized by the health department, and then also sort of our larger collective that publishes the Community Health Needs Assessment, Community Health Improvement Plan. And it's a really thorough sort of overview of here are different places you can go to find different types of data. Not necessarily research, but just data sets that are available, things like that, that are incorporated, utilized throughout the Community Health Needs Assessment, Community Health Improvement Plan, and sort of all of those other planning processes that we complete, and then also the ones that we collaborate with Allegheny County and other counties throughout the state on. So I just want to make sure that everybody knew that this is where that's at. As a reminder, it's on the Health Department website under News, Garrett County Child and Adolescent Wellness Workgroup. And then particularly if you have questions today, you're certainly more than welcome to email them. But this recording right here from the April 2025 meeting might provide a lot more context, a lot more detail about what we're going to talk today if you have any questions about specific data sets or resources that are mentioned. So clicking back to the agenda here, as I mentioned, this is going to be the focus of today is the behavioral health data packet. This is a preliminary packet. So I'm going to go ahead and just jump in and start screen sharing here. Give me just 1 second. And can someone confirm before I get rid of this little box that they can see this presentation? Fantastic. Thank you. Thank you. Thank you. Okay, so I'm going to click off of that. So today is the preliminary behavioral health data packet. This will most certainly be updated. So to kind of kick things off, There's several sections for the presentation this morning, but I just want to highlight some of the data sources that are included. Several of these are talked about in more depth in that recording that I just kind of highlighted and focused on for a second there on the Health Department webpage. But these are some of the resources that are available. We'll talk about some of these today, but I just wanted to make sure that we went over this for the county level, the state level, and then the national level. Sort of what's out there, what's still available, what's useful at the moment, and we'll just kind of go through this process. So the Data Insights Dashboard is what Shelley has been working on since the last Community Health Improvement Plan. There's a really fantastic one for mental health. There's not one at the moment for substance use, but the mental health one is very robust. It has a lot of details. There are really good contributions from the Garrett County Local Behavioral Health Authority and Local Management Board in there, as well as several other community partners. There's some detailed information from DSS and other agencies as well. So that's a really good thing to check out. The links will all be in this and it will be posted. We'll highlight some of this here in a minute. The Community Health Needs Assessment. So there is the 2024. There's also the more recent sort of portal where you can go back and see all of the historical versions going back to 2016. And 2016 is the published year. So what you see on all of these years are the years of publishing. Sometimes they've taken place for a year or even years prior to that. So it's a pretty good longitudinal data set for how our community is identifying and prioritizing needs, but then also what is the supporting information, the focus groups, some of the data that's collected alongside those. The Community Health Improvement Plan, this is sort of the action plan. This is sort of like the next step in the process for our county as well as Allegheny County. Have some exciting things to share about that later. But this is sort of where we're heading as a community. This is not specific to behavioral health, but this is sort of across those priorities that are identified in the Community Health Needs Assessment. The Open Data Warehouse is getting ready for a pretty big upgrade. In case anybody's been trying to find data recently, you know that a lot of things have been moved, things are shifting around. So we need to do a pretty substantial overhaul on that, and that is kind of queued up in our list of projects, particularly the state resources because of the changeover in the state health assessment and state health improvement plan, but also from federal resources as well. And then the data hub is really specific to the health department. So this is where the status of health lives. This is where a lot of our annual reports for the agency live, and sort of at-a-glance documents that are available. I can't see that, so somebody can check who's trying to get in. The status of health reports, as I just mentioned, are what is presented by the health officer. So those are really good explanations of sort of where we're at for a lot of key indicators. So key performance indicators that are set by the state health improvement plan or by sort of other mandates or really just goals that we're trying to achieve as a community. And then mygarrettcounty.com I think is probably the best resource out of all of this because it's real time, at least as real time as it possibly can be. And that's where action groups live. There are over 200 groups. There's just under 200 that are publicly visible, but there's just a lot being tracked across Garrett County in terms of programs, even some systems. And it's always worth just taking a look at My Garrett County, seeing what's new, sort of how things are trending. In the previous call, we talked about the resource guide, the digital resource guide that's coordinated by the local management board, and really how that data has had a pretty substantial increase. So that's just one example of sort of digging into those action groups, looking at them and seeing, okay, you know, is there anything that's sort of emergent? Is there anything that's really changing in our data that might sort of warrant further exploration? Do we need to look at it? And behavioral health is certainly one of those areas. Maryland data sources. So here's just a couple of resources. So MDH interactive dashboards. That's actually one of the biggest reasons why I waited a minute to put this meeting announcement out, because I was waiting to see if we got one of the new dashboards, but we haven't yet. So these are pretty new. We've had an overdose one for some time, but they have recently revamped the overdose dashboard. But there's also several other dashboards that are in the works. We'll also talk about one of those for a minute today, particularly around maternal health and how all of this ties into behavioral health, particularly as we're looking at outcomes for children and adolescents. But these interactive dashboards are really good because you can often filter things down to the county level or the regional level. Sometimes the data for Garrett County is suppressed, also sometimes true for Allegheny County, but certainly much more so for Garrett County. And unfortunately, there's just not a lot that we can do with that. We have to typically wait until there's more longitudinal reports for some of that. And those are usually published as PDFs rather than this interactive dashboard. There's also some reporting systems that are available. The hospital coordination dashboard is a really interesting one as well, to kind of see what the utilization looks like in terms of beds and other resources. The BRFIS and YRBS. YRBS has a huge focus in terms of sort of its importance in weighting things, not only in child and adolescent health, but also just really across substance use and other factors across the state. So that's always, I think, one of the most important resources. And our health education and outreach unit, together with the Drug-Free Communities Coalition, does a really good presentation on this. So our HEO unit puts together a lot of resources, tries to find the most important information, because this is a pretty robust report, particularly the way that the state goes down and analyzes it really at the county level, and then by the sort of grade band level, whether it's middle or high school, based on the YRBS standards. So I do think that that is a particularly useful data set to be knowledgeable of, to know what is sort of in there and what the trends are, because this is a data set as well. Both BRFIS and YRBS do tend to have some movement within those data sets, because they do track things with a pretty high level of granularity, particularly the YRBS. And then the Maryland SHIP, so there is a new state health assessment and state health improvement plan. Collectively, it's all building healthier Maryland. So there's a lot of information there as well. So moving forward, national data sources. So there's a couple of things that are particularly key for behavioral health. Behavioral health, just to back up a few steps, was identified as the priority focus for the Child and Adolescent Wellness Workgroup. We sent out a Google survey. Those were the responses that we received, and that was the highest identified priority by this work group. So this is also an area that's pretty well prioritized through our community health needs assessment, but it was the highest among those who participate in this work group. So these are just some national data sources that might have some additional information. So the provisional county level drug overdose death counts, that's often quite behind the state data that's available in the previous slide. CDC Wonder, also multiple causes of death, is pretty interesting. CDC Places has some really interesting information as it relates to behavioral health, particularly clinical behavioral health. County health rankings and roadmaps, there's still a lot of uncertainty about what the future for that will look like, but at the moment that has some pretty good longitudinal data. There's some estimates in here as well as fine treatment, but I do think that for the most part we have better resources at the local and state level rather than the national data sources, because they just typically tend to be quite behind to really be useful in implementing in grant writing or any other activity that's not longitudinal. So to kind of recap some of the things that we talked about, so the Community Health Needs Assessment was recently published. Sometimes it's called Community Health Needs Assessment, sometimes it's called the Community Health Assessment, so the CHA or the CHNA. So this is available on My Garrett County. It's also linked on the Garrett County Health Department website, and it is just a really substantial piece of work in terms of how detailed, both wide and deep this is for a lot of health related factors. It has the prioritization data, so you can actually go into this document, and the links are available at the bottom of most of these slides. So Shelley Argabright, our Chief Health Strategist for Garrett County, coordinates this process with partners from the hospital, Mountain Laurel Medical Center, Fred's offices, Local Management Board, Local Behavioral Health Authority, Community Action Agency, and a lot of other community stakeholders. But this is just one of the really cool things where you can see how things have trended over time. And one of the things that I think is really interesting to point out, just as it relates to behavioral health, is that mental health obviously has went up significantly. In the last cycle, it was our largest priority. In this cycle, it is the 4th ranking priority, but these are all based on percentages. When you look at the core numbers, the number of people who identified mental health as a need actually went up because the sample size was larger. And then the one thing that I think is really interesting is that over all of these cycles, the only area that has consistently actually went down in terms of prioritization, priorities that were identified by the community as needing addressed, was substance abuse. So substance abuse. And I think that there's a lot of really interesting things to kind of dig into that, because prioritization is often based on, what we think are needs. And when we look at areas where we've had really significant community investments, where we have just so many systems working in our county, from our health education outreach unit to our behavioral health clinic, to all of the behavioral health providers at the hospital, at Mountain Laurel Medical Center is our federally qualified health center, and community level providers, as well as the public school system. So many people are involved in that. Historically, over the last decade, I just think that we've developed a really robust system, and there's a lot more research that we could do into this, but that's just an interesting thing to kind of point out, because this is such a large, representative, and statistically significant significant survey, one of the few that we do that has that sample size to really provide that validation. I think it's just really interesting to point that out. There are also community level snapshots for any zip code region in the county that had enough of a participation in order to include it. So anything that just approximated a representative sample. So this is an example of Kitzmiller, and you can see that the priorities are often different on the community level. Oftentimes Oakland, because of the population size being almost half of our county in the 21550 zip code, tends to weigh more heavily on that totality of the county level data. But these are really handy reports if you're looking at a specific community. So those are in there as well. This is from the Sharp. The Sharp is an interactive portal, really similar to that state interactive portal that we talked about earlier. This is undergoing maintenance. This will be back up by Friday. We're updating the back end of this. There's some cool new tools that just came out, so we will have that turned back on live. There's a maintenance page there at the moment. That'll be back by Friday. I think someone might be trying to get in, so this is an interactive dashboard. You can click in. You can like if you wanted to see more about dental health or what we're talking about, just behavioral health today, you can click in those things and see more information about where people are identifying these needs, things like that. It's fully interactive. This is for the PDF report. So this is one of many things in the community health needs assessment. It's a really robust document. As I mentioned, it has many components. Shelley leads this process for pretty much a year at a time. And it is very thorough. So this is just the example that we talked about during previous recording in April. It is mental health providers. So you can really look at zip codes. This includes a lot of different services rather than just a traditional clinical therapist. So it's always worth kind of diving into the methodology as well. Methodologies for all of these are also linked underneath. And then you can also see rankings for many of these based on how we compare to Maryland and the United States as a whole. But the zip code information is particularly valuable. It was expensive. Our health officer, Jennifer Hare, was able to get us some funding in order to get this additional data, which often does come at a premium. So we hope that people utilize that, and not only utilize it, but tell us that they're utilizing it so that we can really figure out if that was a worthwhile investment to collect that zip code information. And then for many of these, there's also a GIS or geospatial element. Two other things that are linked in that data insight I talked about that Shelley also coordinated. It started in 2022. That's why there's a date in there, but it has been updated since. The adolescent wellness surveys, which was what was conducted by this group, I think is one of the best examples of data collection, particularly for child and adolescent populations. It was conducted in the middle school and in the high school. It's absolutely worth a read. If you're not familiar with this document, I would highly recommend it. If you're coming to this meeting, you probably have an interest in this population. So it's definitely worth looking into. An interesting thing, just as a side note, that I was talking to one of our colleagues about yesterday was that this was actually a photo from a program that our health education and outreach unit conducted almost a decade ago. So this kid is probably not an adult, but this is a really good report to go back and look at. And then also the behavioral health assessment. There was a pretty robust assessment conducted by Fred's office, local behavioral health authorities specifically prior to the pandemic. This is a really good public report that's available that also looks at some of the conditions that people think are really important. So it's a bit more of a deeper analysis into behavioral health elements. My Garrett County, as I mentioned, is a great resource to find a lot of different groups that are working on not only strategies that are clinically behavioral health, but some of the many supports as well that we'll talk about here in a minute. You can click on action groups and see all of the different action groups that are available. Some of them are programs, some of them are systems, some of them are also just support, like this grant development group. This is a really good group, a fantastic group. Chelsea and our health education and outreach unit started this or participated in carrying this forward for many years before she became the director of our health education and outreach unit. And now her staff are participating in keeping this up to date. But this is just a really good example of a fantastic group that has some of the best longitudinal data that I think that is available across the entire state, particularly as it looks at all of the factors that go into overdose response. So that's a really good group to explore. Clicking through here, you can see that these groups contain a lot of qualitative information. So in terms of the strategy, the focus level, how it ties into our community health needs assessment across Garrett County, as well as categories. You can see all of the data in a tabular format. This is really similar to what you'll see on that interactive portal as well for the whole county-wide reporting. But this data can also be exported, and you can incorporate this not just specifically for this group, but across all of my Garrett County groups that are publicly accessible. It's a really good resource for grant writing and other activities as we start to explore strategies to actually impact behavioral health for child and adolescent populations. In every group that does report data, you can see a longitudinal analysis of sort of how performance has changed over time. This back here is when I was involved in between Bob working in behavioral health and becoming the health officer, as well as when Dr. Corder joined us and had involvement here. A lot of this is where Chelsea has just really, done fantastic work in this program. I think it's one of the best examples of not just action groups, but programs implemented in Garrett County that have just really been well implemented from a systems level. So this is a good example of what that data could look like. And for a lot of these groups, the data does date back to 2017. So we're coming up on having almost a decade of longitudinal data for many of these action groups. The data can also be visualized on a fiscal and calendar year. This can be really helpful if we're trying to find some of these trends within in different systems. This group kind of follows the same like yearly reporting cycle. So if you saw that in the previous slide, it kind of is tracking this cumulative process. But in some groups, this can be really helpful if you see a major drop off in services or things like that. So this is always a really good tool to utilize within my Garrett County. We also have groups. This is an example from our behavioral health, our Center for Behavioral Health, which is our clinical services at the health department. So you can see some of the projects that they've worked on, such as crisis services. So the thing that I really want to point out with my Garrett County is we started talking about some of these strategies for behavioral health, particularly for child and adolescent populations, is that we don't always have to start from scratch. Oftentimes, there's already a lot of really good work that has happened historically that can be incorporated. We can learn from that. We can see what was successful, what wasn't successful, and sort of analyzing that. And this was a really good example of a project where they were able to increase those numbers. And you can see a lot of the qualitative information for that as well. And then, as I mentioned, we are heading towards the Community Health Improvement Plan. That's another process that Shelley coordinates as the Chief Health Strategist for Garrett County. So we will be having some updates on that in the coming months. The other thing I want to mention that is new from the last time we talked about some of this data is that Allegheny County has just recently published their community health needs assessment. So congratulations to our colleagues in Allegheny County. It's a really fantastic document resource that's available. They're also working on revamping AlleghenySpeaks.com, which is the Allegheny County version of MyGarrettCounty.com. But this is a really cool tool, not just because it's so robust and thorough, it's sort of comparison to our community health needs assessment, but it's really closely linked. So the process that both counties, Garrett and Allegheny County, followed this cycle is really similar. And I think that one of the really tremendous advantages in doing that is that we are able to look across two different counties and see, do we have discrete strengths, weaknesses, opportunities, threats, sort of a SWOT for our population basis. But at the same time, what do we do well and what do we both not do well at? And what can we create economies of scale? What can we collaborate on in terms of grant development to build programs and systems? So this is a whole new massive document for everyone to go read, but it has just really tremendous information. Melissa and Carrie and Allegheny County just did a phenomenal job on that. So I recommend that you absolutely go to AlleghenySpeaks.com and read the Allegheny County Community Health Needs Assessment and just explore that, because I think that there's some really interesting information when you look at, what are some needs that have been identified regionally, and what are some other areas that we might be able to collaborate on sort of across counties. So one of the, kind of switching into the Maryland data now, one of the things we talked about is the WireBS. So this is the link to actually access some of that WireBS data. And this is just an example of how some of this is broken down. As I said, I think our health education and outreach unit does a really fantastic job kind of developing a presentation about things that they're really particularly interested in looking at. But there's also other things that fall outside of that program area. So this is where you can find that full information, sort of download all of these. The one thing to note is that they did switch this year because of some vendor changes from doing a PDF report that had really nice visuals to just doing XLS Excel files. So it is a little bit more cumbersome to navigate, but I just want to make sure people know that that is available, and that's where you can find it. And I believe the 2022-2023 cycle is the last one that's currently available on the WireBS website for the state of Maryland. The other thing I want to mention is that this was from the old state health improvement plan, but this data is still being updated. It was just updated this year. So it's just interesting to be able to know sort of what's out there, what's available, particularly as it relates to comparisons. So two of the things that this group has worked on in the past are the ones that I pulled, just so that you can see this is where we're at. So this is a strategy we've worked on for, again, almost a decade, several years since this group has been sort of instantiated adolescent well-child checks. You can see that Garrett County is not the bottom performer anymore, but we are still third from the bottom in terms of conducting adolescent well-child checks for what qualifies under the state methodology. So, and you can access that again on the slide, so that there's information on there. But just an interesting thing. So there's still a lot of work to be done in a lot of these areas, and they also do, in many ways, kind of tie back to behavioral health. Like, for example, this is a really good opportunity for a check-in. We have some providers, Mountain Laurel is one that I think of immediately off the top of my head, because they do that really robust screener for their patients when they come in for any kind of physical or anything like that. So so just be aware that this data is still available, and even though this is not one of those core measures at the moment that's being tracked, the data is still in there and it is still updated. So that's important. And another example is child maltreatment, which is a really complex topic. There's a lot of things going on there, but you can see that still that's where we're still at. The new state health improvement plan, part of Building a Healthier Maryland, the one thing I do want to point out is that they have published some behavioral health resources. This is one of the other things that I was waiting on before I kind of finalized what we were going to talk about in this presentation today. But the behavioral health section has been built out a little bit more. So that is available. The link will also be available in the posted PDF. So I do think that that's worth looking at. And there is a lot of this WireBS data. So when you're starting to look at things, I'm not sure if this one's WireBS or not, but there is a lot of WireBS data throughout the section. And again, if you look at the populations, a lot of the population focus does tend to fall within the scope of this work group, child and adolescent populations. So just wanted to point that out. The other thing that I think is really interesting is several of the clear impact dashboards have been updated. This is the one for the state health improvement plan that is being tracked for behavioral health as a focus area for the Building Healthier Maryland State Health Improvement Plan. That is a mouthful, I know, but this is a really good example. So you can see that they are following the RBA, which is results-based accountability. Fred's offices, local behavioral health authority, and local management board do a lot with RBA. That's something that we've talked a lot about in the past, not specifically within the context of this work group, but across a lot of the things that happen at the health department and systems level planning for all of Garrett County. But this, I think, will be a really interesting thing to see. These are just the metrics that they're being tracked under behavioral health as a focus area in the state health improvement plan. So it's mental health related ED visits, suicide rate, number of youth SUD treatment providers, and then utilization rate. So that is in there, and then the link is below if you want to look into that a little bit more. So one of the things that I want to mention before we get into the what can we actually do about all of this section this morning is I just wanted to mention non-clinical behavioral health intervention, because in the past we've talked a lot in this work group about really clinical interventions that are incredibly difficult to conduct as a rural community, right? So we've talked a lot about provider shortages, we've talked a lot about payers and reimbursement models, and a lot of just complexities that are really outside of the scope of our control or would require substantial capital. But one of the things that I want to mention, and Fred's team, if they're on this morning, might be able to talk about this more when we get to the discussion, but really supporting a lot of sort of mixed clinical and non-clinical behavioral health interventions, but also non-clinical behavioral health interventions. Our health education outreach unit does a lot of these. AHEC West has a lot of non-clinical interventions. Mount Laurel Medical Center does as well, as do many of our community partners, agencies, and also community groups. There are churches and other organizations that also participate in things that I would really classify as a non-clinical behavioral health intervention. So just kind of on a hunch, I fed this through ChatGPT, which I do think is, you know, good and bad, but it is really good when you're trying to do a lot of PubMed research for sort of what are evidence-based practices, and just find some links to things that you can explore a little bit further. So here were some things that I found. I deleted some of these because I didn't think that they were super relevant to our community because of our rurality, but this is just a list of some things that I quickly was able to find as non-clinical behavioral health interventions, sort of as we're thinking about strategies for what can we actually do, or as we start getting to some grant development and, you know, how do we fund some of these projects? What are some system supports that can really help some of the need that we're seeing in our community? So kind of flipping through these pretty quickly, school-based prevention and universal programs, social and emotional learning is an evidence-based practice. CBT-oriented group interventions in schools are evidence-based practices. Suicide prevention programs, creative and community-based activities, such as arts and group projects. Exercise-based interventions for self-esteem improvements. Non-clinical continuation, resilience and coping skills. The FRIENDS program is an evidence-based model, peer-reviewed findings. So CBT mindfulness, self-compassion training, parent-focused interventions, parent management training, attachment-based interventions. Again, all of this will be available. Environmental and system-based supports, communities that care framework is an evidence-based practice. Positive behavioral health supports is an evidence-based practice. Restorative practices, looking at psychoeducational efforts, support groups, again, lifestyle and digital-based interventions, healthy habits, nutrition, physical activity. There's a lot of programs happening in that space. E-health apps and augmented reality, some of the video game things that are available now. And when I think about non-clinical behavioral health interventions, the thing that I really think of, particularly in the school systems, that really stuck with me was the focus like an arrow presentation that I know has happened at least since I was in 6th grade. But it's something that my friends and I still talk about when we're talking about behavioral health. So it certainly was, I think, an effective intervention that at least had some sticking power, you know, 2 decades later, not to age myself there too much. So what's next? So I've just thrown a ton of information at everyone again, but I wanted to kind of give you some ideas of where we could potentially go as a work group, now that we have a little bit more information specifically as it relates to behavioral health for child and adolescent populations. And again, I know we don't have the time to cover all of this comprehensively, but hopefully with all of those links, you'll be able to kind of sort of go out and explore when you have access to the PDF. So here's some activities that could potentially happen, that the work group could be involved in. Asset mapping, so building off of the Garrett County Local Behavioral Health Authority Provider Guide, which is a really good resource that I haven't gone too far into. Hopefully there's some staff here today that can talk about that if folks have questions. But that's a really good resource that looks at all of the clinical providers that are available in Garrett County. The Local Management Board Resource Guide has a really robust database of resources that are available for clinical services as well as non-clinical interventions and resources, community-based organizations, groups, all kinds of things are available in that. But one of the things that we could look at doing as a work group is sort of asset mapping on a broader basis and really looking at, okay, do we need to have a just dedicated asset map for behavioral health, specifically for folks who are trying to navigate systems, because that still continues to be an issue. I recently had someone that I was trying to get an appointment with a behavioral health provider, was having a lot of struggles trying to actually get into an appointment. So I was able to utilize that provider guide, and after a little while, we were able to find a solution. But certainly, the navigation of behavioral health systems is very difficult. We know that. I know that from firsthand experience, trying to find those placements. So that is an option that we could look at as a work group. A needs assessment, certainly not doing another full community health needs assessment, but something similar to what Fred's office has completed in the past, like more of a depth analysis, really trying to figure out what exactly do we need? Do we need to focus on clinical interventions, even though they're much more difficult and systems oriented in order to really address? Could we start to explore things like non-clinical interventions or even hybrid interventions, sort of augmenting our staff to provide additional resources such as caseworkers, sort of folks, whether they're community health workers, or whether they're licensed folks. What does that look like, right? So in terms of support systems, so that's an option. A gap analysis is another option. Instead of doing a depth analysis, we could do a gap analysis. So looking at what's missing. So sort of just this, we already have a lot of data. I've talked almost without a breath for about half an hour at this point. So we know that there is a substantial amount of data. There's not a substantial amount of depth data. It's more breadth, sort of looking like far and wide. But could we just look at what's missing? Are we already in a position that we kind of have a hunch in sort of looking at publishing a gap analysis for behavioral health with a focus on child and adolescent populations? Grant development is always a hot ticket item. There's always a lot of interest in doing that. So developing strategies and discovering opportunities for grant development. So that's kind of like once we have an idea of what we want to do, how do we look at actually funding it if it's something that costs money? But the flip side to that is a point that Fred always brings up that I think is a really important point to think about whenever we're looking at any intervention, whether it's programs or systems, whatever we might be trying to do. I think Fred has a lot of wisdom in sort of bringing this up from the RBA framework, is what factors can we influence or refine that are low or no cost? Oftentimes we have a lot of ability to sort of implement things in kind, or look at no cost solutions or low cost solutions that can augment or support existing systems. So that's always an important thing to think about. So that's also an option in terms of, where do we go from here? Oh, here it is. I did throw it in. So the local behavioral health authority provider guide. Also, like I said, this is a really good resource. This is a really frequently used tool when we're trying to find options for folks who are having difficulties navigating the behavioral health system. There might be opportunities to look at that and see if we can make that even more widely used or more useful. Either of those, just because it does have such utility, or could be options. The resource guide on My Garrett County, this is managed by the local management board. We could also look at this. There's been a lot of discussion in the last couple of months, particularly because of a couple different factors. One, the action group for the resource guide on mygarrettcounty.com, which I highly recommend everyone look at. If you look at one of the few things we talked about today, I would really recommend you look at the action group for the resource guide on My Garrett County, because there's been a substantial increase in need over the last couple of months. And that's something that we really want to make sure that we're following as we're doing some grant planning, as we're looking at systems level planning that happens in 3 or 5 year cycles. So that is something that I do think that we need to make sure that we're watching, so that we can see, okay, we do have an increasing level of need, so that we can plan to try to at least accommodate that. So the resource guide is available here, but there's also been a lot of discussion about, could we make this more useful? I built a backend almost probably 2 or 3 years ago that would enable this to be a printed resource guide, but we haven't actually got to that point yet, because that again costs money. That's something we have to plan, we have to fund. So there's a lot there, but I think that's one of the best assets, and it is one of our most utilized programs across the entire health department. When you look at the data that's reported on it, it's self-service. People often use it by themselves. There's also a lot of staff, community action and early care programs at the health department in particular, I know, that do utilize this with their clients to try to find them resources, particularly as we're looking for different ways to cover needs as some programs phase out, new programs start. So that is a resource as well that we can look at. The grant development group is on My Garrett County. We talked about that briefly earlier. That is getting an update here pretty soon. There's been some pretty substantial changes to a lot of the sources that really qualify grants for us. And when I say qualify, essentially looking through sort of aggregating all of the grants that are available, and then making sure that there is at least one entity in the county, whether it's the health department, whether it's a nonprofit, whether it's a health system like WVU Medicine, or whether it's an FQHC, federally qualified health center like Mountain Laurel, looking at the eligibility criteria. Also nonprofits, community-based organizations, and making sure that it's something that we can actually do. We obviously don't have an R1 research facility in Garrett County, so that is an example of a whole section of grants that we are really not practical for us to pursue. But this group is where we do post a lot of opportunities. You can join that group and you will receive email updates. But we are working on a pretty substantial sourcing update to that as well, to try to make that a little more useful, but also to give us some better data about what opportunities we pursued collectively as a county, what opportunities did we not pursue when we're looking back at, sort of gaps in systems. Did we miss an opportunity that we should have took? And then also just looking at areas. So like, what's the ratio of behavioral health grants and funding mechanisms compared to, say, something like chronic diseases or food security. So just giving us a little bit better data and better utility there in that process. My data is also getting a pretty substantial update. That is the open data warehouse on mygarrettcounty.com. So that has a lot of the things we talked about today and even more data. I think there's 100 and some, I don't know exactly, it's 140, 150-ish sources available. And this is data that either is for Garrett County or the Western region of Maryland, sort of looking at the different lenses the data can be analyzed so that you can try to figure out, where we stand, because again, sometimes suppression is an issue when we're looking at just Garrett County. If that count is, 5 or 6 individuals, we have to often look out a little bit broader. It's sort of a Western regional data set. But those data sets are available. Some of these do not work, just quite honestly. Some of the Maryland ones have been changed because of the shift over and the state health improvement plan, state health assessment plan, collectively, again, building a healthier Maryland. It's a pretty substantial change, moving to that RBA model and having different data systems. So some of these links do need to be updated if you are looking at SHIP indicators, as also a lot of the federal resources have changed, moved. There's just a lot of kind of cleanup work that really needs to happen there. So that's one of the things on our radar that we're looking at addressing as well. But this is there's still a lot of, I would say about, probably 80 to 100 of these sources are still, you can click on them, you can see this information. And there's a lot of information on specific health topics as well. If you're looking into some of these things, like I can just see from the screenshot, there's several things here that directly can tie into behavioral health for child and adolescent populations. So there's my information. I'm going to put it in the chat as well, but I'm going to go ahead and exit off of this real quick. And I'm going to bounce back to the meeting here. So give me just 1 second. Okay, I know that was a substantial amount of information, and we really tried to speed run that. So I just kind of want to open this up. Are there any questions about what we talked about, sort of the presentation slide deck itself, or do we want to kind of jump into a conversation about what can we actually do? I presented a couple different strategies that we could potentially look at. That slide with the gap analysis, a more in-depth needs assessment specifically for behavioral health, focusing on child and adolescent populations. We talked about some of those things sort of in that presentation slide deck, but I'm also, I want that level of engagement, right? Like I want to hear what you guys are interested in doing, because I think that anything that we pursue will be significantly more effective if we look at implementing it sort of as a work group rather than this is just a random project that we're trying to accomplish. So I want to open it up. So questions, comments, ideas. What does everyone want to do? This is sort of a starting point for us to jump off of and really figure out, what can we do as a work group to impact systems, particularly in behavioral health, that can be really, really difficult to change, either because of prohibitive costs or just challenges, because a lot of them are clinical interventions and do have requirements, do have licensure requirements, do have sort of system constraints. So let's kick it off. Who wants to go first? I just talked for 40 minutes. Come on, somebody volunteer.
John, this is Fred. I think people were waiting for you to continue talking because you didn't stop. Hey,
I know it was a lot. Yeah.
Quick question. Yeah. So, I mean, you ask a lot of questions. I think the problem is when you ask so many questions, people are trying to think, okay, now what was that one question that he said that I maybe want to answer about? So rather than doing 5 or 6, you ask several different questions. So, the thing is, you can't do, in order to do like, what do we need? That's going to, if you use an RBA approach to this, the question is, what are the quality of life conditions we want for the children, adults, and families who live in Garrett County? And then you can specifically say related to behavioral health. And then people are going to say, well, how is behavioral health identified? So there's two questions that have already been asked. So you have to answer one of those questions. So the question is, when we talk about behavioral health, are we talking mental health and substance use disorder prevention, treatment, and recovery services? And that's yes or no. And that would be for the group to answer that question.
Yeah, I think that is really the first question. I think that the first question is, where do we want to focus? And the second question is, broadly, what do we want to do?
So I think mental health was talked about by this group, or identified by this group, but it's important for people, whether you're clinical based or not, and the clinical people haven't said a whole lot. So the question would be, when you're a clinical person, do you only focus on mental health, or do you focus on other factors of a person's life that contribute to the mental health, which could include self-medication with substances? And so then you're not really focusing on mental health. You're focusing on living environment. You're focusing on quality of life conditions such as food access or appropriate nutrition and physical activity. So clinical people, how would you all identify or define the priority of this group for mental health? What is that going to include? And to define and talk about, to have more structure behind the mental health aspect.
Fred, this is Jennifer Brenneman. When we're talking about mental health and adolescence, it literally includes every aspect of their life, in my opinion. I spent many, many years at school, and when a child has a mental health issue, it's typically, like you said, not just mental health. It's involving their house, their food, their school, their parents, their friends. So that's a very broad category, but it is definitely not a single lane.
Yeah, thank you, Jennifer, for sharing that. And I think everyone, and I see people in the chat box saying they agree. And so then the question becomes, what does this group focus on? How does that get addressed? Or how does that get more quantified? Because we can tell people, we can talk about access. That was, I think, and Shelley and John, when Shelley did the focus groups, the access to care, it was the access to care, healthcare. Majority of the individuals in those focus groups indicated that, physician access is challenging, but access to mental health and substance use treatment is virtually, no pun intended for the meeting being virtual, impossible, because people do not want to have to wait weeks or months. And it depends on what you're asking for to be done in a mental health perspective or a substance use disorder perspective, to have to wait, because we know access to psychiatry, for example, is tough. And access to clinicians is tough. It's school-based. That's where the hub comes into play, the Coordinated Community Support Partnership Agreement that our office runs with Allegheny County. And so kids can get services in schools, but Jennifer, as a former school-based clinician, and there are other people on the call that did that, that's even challenging as well with the way the school system has changed, with the mandated hours of instruction that students have to have. And I think the new school person's with us today. And so it might be good to hear from his perspective as well, like how open is the school system, or how flexible can the school system be to meet the mental health and SUD needs, services for kids in the school, as opposed to after school, which creates issues with scheduling and planning and staff availability.
Well, and I'm just gonna come in that I think in general the school system is open, but then it comes down to very specific issues. The kid you want to see has been absent for 5 days. The teacher needs them. It's all those specific incidences. Most of the schools that we work in are extremely grateful that we are there and accommodating in most scenarios. But there is always testing, field trips, absences. They can't miss this instruction. It is very difficult. There's a short window at the high schools or intervention. But that sometimes gets taken up by remediation, clubs, sports, etc. So it is very difficult. I don't think anyone's trying to make it harder, but it is very hard.
Jennifer, let me ask you, has the space issue been taken care of? Are they accommodating the therapists that are going into the school now? I know that there was some problems with having space.
It depends on the school. Many schools, we have no problems with space, dedicated office space all the time. It just depends on the school. And I'm not sure we've got everyone's schedule worked out at this point in time for this coming school year, but I think that actually Mr. Lewis is going to come meet with us today. So we will be talking to him about that.
Yeah, that's been true for Jennifer. I remember you saying you met in was it a janitor's closet that had to be cleaned out for you to use?
Actually, there was toilet paper behind me.
Okay. Yeah.
We've all been in
I
closet.
remember that. Yeah. So so for people that are interested in that, we won't talk necessarily. It's not a school only issue. So then the problem becomes what other type of settings do we have? And this is where the tier 1 services come into play. I don't think Harley's on the call, so she may be able to explain tier 1. Tier 1 really is for all students in a school setting. And that's where the school systems in both Allegheny and Garrett County have what would be considered a tier 1 approach. And John mentioned the evidence-based initiatives. They're supposed to be evidence-based or promising practice approaches that address in a general way, providing information or or educational aspects for mental health, high stress lifestyle type of circumstances that a student may be experiencing. And then hopefully eventually developing some peer groups within the schools that students can talk to one another in a productive way and helpful way to assist with their ability to remain focused in school and stay academically, on top of things, even when they're coming from some high stress environments prior to getting to school. And so those are things, I don't know, Carly, if you and Katie have talked about it with the school systems yet about I think we have some providers on the call that are part of those service providers that could maybe talk about like an overall approach that goes to every student in the public school systems in both Allegheny and Garrett County. I'm not sure if anyone's prepared, because in these meetings, sometimes people get put on the spot because there's not a lot of, it's a free conversation. Or people that have been involved with the school system might be better to hear from too, to say, hey, here's what my child said was helpful for them. Or when I was in school, and John and I know we'll go back, you said like 20 years ago. So I don't know what happened 20 years ago. You mentioned something about the arrow thing, but what would be effective? Chelsea, you might have an idea, or someone else, about what's a tier 1 level, which is for every student in the school, that could be done to help begin the process of addressing the mental health components that are involved with public school students.
Can you hear me?
Yep.
So this is one thing when I'm talking to our adolescents about that has changed in 20 years is that 20 years ago, there was not something in front of your face from the time you wake up in the morning until you go to bed at night. All the social interactions that take place and all the things that you used to be able to go to school and, maybe there's drama, maybe there's a fight with whatever kind of emotional distress you have. and then you could go home and walk away from it. But now with social media and the cell phones and the tablets and the computers, there's access to that in 24 hours a day. It does not go away. Someone that's dealing with being bullied, or someone that's dealing with, a breakup, whatever it may be, they cannot walk away from that because it's just there for them. And I think that's a big component of some of the things that, in addition to all the other extenuating circumstances that we see, is these kids just don't have a break from the emotional anxieties that take place during adolescence.
Thanks, Jessica, for sharing that. Any feedback or comments on what Jessica just shared?
He's 100% correct.
Yeah.
And for sure, the anxiety and the depression, all of that stuff has increased prevalency, I would say, in the last 20 years. As part of the hub, like being on some of those technical assistance calls and the consortium calls where people have presented ideas. There are some mobile applications, like, I can't remember the name off the top of my head, and I have to go back to my notes, but like where it's sort of like a check-in. But it's an app which doesn't decrease the amount of FaceTime on the phone, but it's a helpful resource. Just like, checking in, checking out, having good advice, things like that. I have to look up the name, but it seemed like it was very helpful in the districts that were using it, and had really good feedback. I don't know if that's something that would be available to everybody.
Yeah, thanks, Jennifer. I do believe that Allegheny County is utilizing, someone help me, for this upcoming academic year. It's
Mind-body medicine. Mind-body medicine through AC.
That's one of them, Melissa. Thanks for sharing that. But there's another, it's more of an app related. Who's doing, someone?
I think it's Hazel Health, Fred.
Yes, thanks, Lindsay. Yes, Hazel Health. And so they applied for both Allegheny and Garrett County to be a service provider. Allegheny said yes, Garrett County did not. And so this is it does, Jennifer, what you were saying or talking about, where they can do support text messages, daily check-ins or weekly check-ins, depending on what's going on, what the student would like to see happen. And then the other issue too is the school systems have to have the staff that I think have to be trained a little bit to allow the app to be utilized if needed during school. And so I know the school systems in Maryland some of them have gone kind of with a ban on cell phones to assist with that during instruction time, and then maybe letting kids have their phones or tablets during lunch. I'm not sure what Garrett County is going to do or what their process will be. There are some dilemmas with that as well. If you have medical conditions that require an app, you have to have your phone close enough to where you can get the readings to assess whatever you need that for. So there's a lot of talking points. But Jennifer, I think, we've heard probably significant, that was a popular thing that you would say when you were a school-based clinician. And even since then, is just kids always want their phone. They're on the phone constantly. And most of us adults are too. I've been to meetings where 95% of the people in the meeting are on a tablet, their phone, or doing whatever else they need to be doing other than, well, it's not other than, but being actively engaged in what's going on in the meeting. Most of us right now, even though we're on our computers for the virtual meeting, are probably involved in accomplishing some other work-related task while we're on this call. And that's not always a negative thing, but, Jessica made a great point when there's the negativity coming out, or for some kids, even positivity coming out via social media things, streaming platforms, that can also be just as much of a distraction as the negative feedback that they might be experiencing from individuals or just seeing their name posted about something. So there's a lot of different ways to talk about that. And I think Dawn Brown, who's a new provider for Garrett County with Maryland Wellness, Dawn will be is involved with doing the targeted case management for children, youth, adolescent age groups in Garrett County. And she mentioned Sources of Strength as an evidence-based program that can be used as a tier 1 program, which means it would apply to every student in the public school system or even in the community. So thanks, Dawn, for sharing that. And so let's get back to the question. What was it, John?
Yes, a couple of things. So it is 9:29. So I do want to let people know that if they have to leave at 9:30, they can. We can run a few minutes extra if we need to. But yes, so instead of going completely back to the question, one of the things I'd like to propose that maybe we could just get some feedback on is, could we do a part 2 next month where we can really talk a little bit more about some of the assets, like some of the asset mapping we just did in conversation here, talking about, what's coming, what's available, specifically some of the new support spread from your office, I think would be really helpful. Because I knew that there were at least 2 things that I wrote down that I didn't have prior knowledge of that I think are really important for making sure that we know kind of what the system looks like at the moment. So maybe we could do a part 2 next month where we could just talk a little bit more about some of the current and upcoming assets that are available. And then kind of come back to this conversation of, one, or do we want to focus on mental health, or do we want to keep it broad as behavioral health? We haven't decided yet as a work group whether we want to look at just one specific condition, well, not one specific condition, but mental health is a focus area, or sort of this broader behavioral health, where it might be mental health or substance use or a combination of something of the both or 2 or more. So that is potentially an option that we could pursue, is just to take us to next month, which would be September, where we could talk a little bit more about strategies and kind of explore some of the things that could give us a direction that we want to go toward as a work group. How does that sound? Okay, I got 2 thumbs, 3 thumbs. Okay. So Fred, not to put you on the spot, could we call on your office to give us a little overview of some of the community supports?
Next month?
Mm-hmm.
Yeah.
Okay. I think that would be a really good way to kind of start that off and talk about some of those, because that in particular, I think, is looking at some of the strategies that we can implement that sort of offer this broader range of supports that we've talked a little bit about today, and some of the data supports as well. So we can start with that, and then we'll go into an open conversation, and I'll bring that slide back, just the one this time, I promise, not the full slide deck, about some of the options for different directions that we can go in once we sort of figure out what our specific focus might be. Okay?
Yep, sounds good.
I know it's early, everyone. So we will post this recording, and I'll post the full slide deck. I know that was a ton of information to try to absorb, and I'm sure people have a lot of questions about specific parts of it. So I will post that. That will be available with all of the links to where you can go and look at that a little bit further. And then next meeting, we'll have that broader discussion about sort of the what do we want to focus on, and what are some broad directions that we can head in to start addressing it, or figuring out what needs to be in place to support addressing it. Okay, so everyone have a great day. Oh, sorry, we're going to open up to agency updates and comments, public comments and agency updates. Does anyone have anything? Okay, hearing none, we're going to go ahead and close out the meeting. Thank you, everyone. This morning, like I said, next month, definitely come. We will kind of dive a little bit deeper into this topic and have a couple discussions based on what we talked about today. So everyone have a great day, and I will see you next month, hopefully. Thanks.
Thanks, John.